Good day, ladies and gentlemen. Thank you for standing by, and welcome to the I-Mab Biopharma 2020 Financial Results and Business Update conference call. At this time, all participants are in a listen-only mode. Later on, we will conduct a question and answer session. For the Q&A session, if you wish to ask a question, please press star followed by the number 1 on your telephone keypad and wait for your name to be announced. It is now my pleasure to turn the conference over to Jiren Zhu, I-Mab's Chief Financial Officer and Director. Please go ahead, sir.
All right. Thank you, operator. Everyone, welcome to the I-Mab 2020 full-year financial results and a business update conference call. Earlier today, we issued a press release providing a review of our financial results for the full year ended December 31st, 2020, as well as an overview of our recent corporate highlights and upcoming milestones. The press release can be accessed on the investors portion of our corporate website. Joining me today on the call from I-Mab's senior management team are Dr. Jingwu Zhang, our founder, chairman, and director, Dr. Zhong Shen, our chief executive officer and director, and Mr. Yifei Zhu, our chief commercial officer. Dr. Zhang will provide a high-level overview of our business strategy, recent achievements, and upcoming milestones. Dr. Shen will then comment on the status of our key development programs in greater detail. Mr. Yifei Zhu will offer some remarks on our commercialization strategy, and I will then provide a brief summary of our financial results for the full year ended December 31st, 2020, before we turn the call back over to the operator to take your questions. Please note the discussion today will contain forward-looking statements relating to the company's future performance and are intended to qualify for the safe harbor from liability as established by the U.S. Private Securities Litigation Reform Act. Such statements are not guarantees of future performance and are subject to certain risks and uncertainties, assumptions, and other factors. Some of these risks are beyond the company's control and could cause actual results to differ materially from those mentioned in today's press release and this call. A general discussion of the risk factors that could affect I-Mab's business and financial results is included in certain filings of the company with the Securities and Exchange Commission. The company does not undertake any obligation to update its forward-looking information, except as required by law. During today's call, we will also discuss certain non-GAAP financial measures for comparison purposes only. For a definition of non-GAAP financial measures and a reconciliation of GAAP to non-GAAP financial results, please see the financial results news release issued earlier today. Now, without further ado, I will now turn the call over to Dr. Jingwu Zhang, our founder, chairman, and director. Dr. Zhang, please go ahead.
Thank you, Jiren. Thank you to everyone for joining us. It is a pleasure to welcome all of you to our call today to discuss our business updates and financial results for 2020. I'm happy to set a stage for the discussions at this call. Since our IPO a year ago, we have made remarkable progress and delivered outstanding results in the following 3 areas: rapidly advancing our globally competitive pipeline, establishing global deals, and building our commercial and manufacturing capabilities towards an integrated global biopharma company. First, I would like to tell you about our rapidly advancing pipeline. Despite the challenges we faced by the global pandemic, we remained focused and managed to accomplish 18 significant clinical milestones since January 2020. And as a result, our pipeline today has progressed to include 3 registrational trials with the first NDA on track for submission this year, as well as 16 phase 1 and phase 2 clinical trials, either ongoing or to be soon initiated in both the United States and China. It is a really remarkable achievement by the company. Our innovative pipeline now consists of 16 novel or highly differentiated assets, with 11 in clinical development stages and 5 in the preclinical stage. The 2 pre-NDA stage assets, CD38 antibody, felzartamab, TJ202, and long-acting growth hormone, TJ101, are progressing rapidly towards NDA in China. In addition, 2 highly differentiated clinical assets, CD47 antibody, lemzoparlimab, or TJC4, and CD73 antibody, uliledlimab, TJD5, have advanced to become global frontrunners in their own drug classes. Moreover, our bispecific antibodies are now moving into clinical trials in the U.S. A series of critical development milestones have been accomplished across our deep and growing pipeline. On the business development front, we have achieved a landmark deal of a global collaboration with AbbVie for lemzoparlimab, our highly differentiated CD47 antibody, last September. As you know, our corporate strategy is to discover and develop novel or highly differentiated assets internally and out-license the ex-China rights of some of our globally competitive pipeline assets to big pharma companies. This has been exemplified by our global collaboration deal with AbbVie. I-Mab granted AbbVie a global license valued at $1.94 billion to receive a upfront payment of $180 million and the first milestone payments of $20 million in 2020. I-Mab retains the right to develop and commercialize lemzoparlimab in Greater China. We believe that this global collaboration with AbbVie will greatly facilitate the clinical development, manufacturing, and commercialization of lemzoparlimab globally and in China. Now, going forward, we will stay focused on the 3 areas to continue create value for the company and our shareholders. Firstly, we will strive to accelerate our pipeline development to deliver on a series of critical milestones, which I will talk about in detail. Secondly, we will forge more potential global out-licensing partnerships for uliledlimab and other innovative assets currently being developed in our pipeline. We will also selectively in-license late-stage assets or globally marketed products to enrich our current pipeline. Thirdly, we will facilitate the ongoing transition of the company towards integrated global biopharma by building the manufacturing and commercialization capabilities. Now, let me first elaborate on our pipeline development. 2020 was a year when many of our assets advanced into clinical development stage. Now, 2021 will be a year of harvest in terms of clinical data readouts and initiation of more advanced and data-rich clinical trials. In terms of data readouts, for felzartamab, our CD38 monoclonal antibody, we will release final clinical data on the current multiple myeloma registrational clinical study, followed by our NDA submission in the second half of this year. For uliledlimab, our CD73 monoclonal antibody, we plan to present phase 1 data on a combination trial of uliledlimab with atezo at ASCO annual meeting in June. For lemzoparlimab, we will have top-line clinical results from 2 ongoing combination clinical studies by the fourth quarter 2021 this year. One is with pembro in patients with lung cancer and ovarian cancer, and the other is with rituximab in patients with non-Hodgkin's lymphoma as an international clinical trial involving clinical sites both in the U.S. and China. In addition, a combination trial of lemzoparlimab with AZA in untreated AML or MDS patients is expected to achieve full patient enrollment by the end of this year. The results will potentially help bridge to a registrational clinical trial in China once approved by China's NMPA. It should be noted that our prioritized goal for lemzoparlimab is to rapidly advance towards registration in China through accelerated development timeline for selected hematologic malignancies such as MDS and non-Hodgkin's lymphoma. We will also present the data from our other clinical assets this year, including phase 2 clinical trial for olanzapine TJ301 in active ulcerative colitis in Greater China and South Korea, and a phase 2 interim data readouts for pramalimab TJM2 US trial for cytokine release syndrome associated with severe COVID-19. 2021 promises to be a more productive year in terms of pipeline development. In addition to the anticipated clinical data readouts, as I just summarized, we will also initiate a series of new clinical trials this year. These new clinical trials are designed to generate critical clinical data that are needed to advance the assets to pivotal clinical studies. For felzartamab, we expect to initiate a phase 1b trial in patients with SLE following the approval by the NMPA in China in the second half of this year. With the preclinical data generated in-house, we have plans to initiate a combination clinical trial of felzartamab with lemzoparlimab as a possible new treatment option for patients with multiple myeloma, with a potential to become the first-line treatment if proven. For lemzoparlimab, we will initiate a new clinical trial in combination with PD-1 therapy in patients with selected solid tumors in the second half of this year in China. For TJ107, our long-acting interleukin-7, in addition to the ongoing phase 2 clinical trial in patients with GBM, we will start another phase 2 combination trial with a PD-1 antibody in China, following the approval by the NMPA in patients with selected tumor types, including triple-negative breast cancer. In addition to the progress on our pre-NDA and core clinical assets, our novel bispecific antibody panel has made a headway towards clinical development. I would like to highlight two of them here, as we have already received IND approvals from the US FDA to start clinical trials in the US. The first one is TJL14B, and it is a differentiated PD-L1-based bispecific antibody that works through 4-1BB that is only active locally at the tumor sites to minimize liver toxicity commonly seen with 4-1BB monoclonal antibody. We are working with our partner, ABL Bio, to initiate a phase 1 clinical trial in patients with advanced metastatic solid tumors in the US. The other one is TJ-CD4B, and it is a novel bispecific antibody that combines Claudin 18.2, a specific tumor antigen for gastric cancer and pancreatic cancer, with a similar 4-1BB that is only active locally at a tumor site. As a matter of fact, we just received US FDA approval of our IND application and expect to start phase 1 clinical trial in patients with advanced solid tumor, including gastric cancer in the US. On the discovery side, we recently announced our plans to generate the next generation innovative assets to expand our immuno-oncology pipeline. The initiative leverages certain transformative platform technologies through collaboration with other companies. Two recent examples are our collaborations with Complex, a EU-based biotech company for cell-penetrating antibodies for intractable intracellular drug targets, and a company called Affinity, a Shanghai-based biotech company for a series of masked antibodies for intratumoral activation of new antibody candidates. Now, let me say a few words about our continued business development activity around global partnerships as a part of our business model. We will continue to seek partnerships for other globally competitive assets, such as uliledlimab and novel bispecific antibodies. In parallel, we will also in-license late-stage innovative assets or globally marketed products to strategically enrich our pipeline as we move towards commercialization. We must build our future to become a global biopharma company while staying focused on delivery on the critical clinical and corporate milestones to generate near-term value. In this regard, we will continue building a state-of-the-art GMP manufacturing facility in China with a pilot plan and a commercial-scale production lines. We aim to put our pilot plant in full operation by 2022 and a commercial production in 2023 to support clinical trial material supply and a drug supply for our commercial products. The facility will exclusively serve I-Mab's CMC and manufacturing needs and will enable I-Mab to control the quality and the manufacturing schedules tailored to our development and our commercialization needs. Importantly, it will significantly reduce our production cost and the cost of goods as a whole. The other area is related to our commercialization strategy and plan. To summarize here, we have begun to execute our commercialization plan that focuses on building a leading position in hematologic oncology in China, leveraging our core assets, including felzartamab and lemzoparlimab, and additional key products to be in-licensed. Our Chief Commercial Officer, Yifei Zhu, will elaborate further in this call. Now, preparation work is underway for commercialization of felzartamab and TJ101 as the two assets are advancing rapidly towards NDA. Through continued out-licensing efforts, our current revenue stream generated by global and regional out-licensing deals will grow and is expected to converge with sales revenues to be generated in a near term, projecting a very promising financial outlook for our company and our shareholders. It is important to mention that I-Mab became profitable in 2020. Jalen will elaborate in his part of this call. With this overview, I will now turn the call over to Dr. Jun Sen, our CEO, who will review the status of our active programs in greater detail. Dr. Sen.
Thank you, Dr. Zhang. Let me begin with our core global front-runner assets. And first, lemzoparlimab, also known as BGC4, has taken into the center stage among our core assets as it enters into the late phase of development. This is internally discovered and developed and highly differentiated CD47 antibody also represents one of our most active programs. As we have discussed in the past, lemzoparlimab is designed to minimize its binding to normal red blood cells while preserving its strong anti-tumor activity. This unique feature enables lemzoparlimab to be differentiated and potentially holds the advantages in safety, favorable PK profile, or lack of the safety effect, skipping the need for a priming dosing strategy in comparison to other CD47 antibodies that bind strongly to red blood cells. Data from our phase 1 U.S. dose escalation study, where cancer patients were given different doses of lemzoparlimab from 1 to 30 milligrams per kilo, were evaluated for drug safety, tolerability, and PK/PD profile. The results of these dose escalation studies were able to validate the clinical differentiation. The data have been presented at CITIS in November of last year, shown lemzoparlimab was well tolerated up to 30 milligrams per kilo on a weekly infusion schedule as a single agent with no dose-limiting toxicity and no clinical or laboratory evidence of hemolytic anemia were observed. In addition, lemzoparlimab exhibited a favorable PK/PD profile, does not require a priming dosing strategy, and shows preliminary clinical efficacy of 2 partial response and 3 stable disease in a sample of 15 evaluable patients. This ongoing U.S. phase 1 study has been expanded into a combination treatment with pembrolizumab in cancer patients with NSCLC and ovarian cancer. The results of the ongoing clinical study are expected in the fourth quarter of 2021, with more clinical data coming from our ongoing U.S. clinical trial, from reports of other companies of the same class, and more importantly, from our translational medicine research, where specimens of various tumor types are analyzed for the level of CD47 expression. We are in a better position to initiate a phase 2 basket clinical trial in patients with advanced solid tumors that are selected for a higher probability of success in the second half of 2021 in China, which may subsequently lead to a pivotal trial later in China. Concurrently, we are running a combination study with rituximab in patients with non-Hodgkin's lymphoma and enrolling patients from the U.S. and China simultaneously through an MCT mechanism in order to potentially bridge to a registrational clinical trial in NHL in China. The preliminary data readout of this trial is expected in the fourth quarter of this year. In China, our prioritized development goal is to accelerate the development of lemzoparlimab and achieve approval as fast as we can, and as the first CD47 antibody product in China. MDS and the possible NHL are being considered as the potential first indications, as they hold the highest probability of success for accelerating approval. With IND already approved, we are about to start an advanced phase 2 clinical study in combination with azacitidine with 2 dose arms, which are patients with AML and MDS respectively. This study could potentially bridge to a registrational trial in patients with MDS in China next year. Secondly, our inebilizumab, or TJD5. It represents another promising immuno-oncology target under clinical development globally. Inebilizumab is shown to strongly suppress tumor growth especially when combined with the PD-1 or PD-L1 inhibitor in preclinical studies. As Dr. Zhang mentioned earlier, we have completed a phase 1 clinical trial in the U.S. The top-line results demonstrated safety and clinical activity. These results have been submitted to ASCO 2021 annual meeting for presentations in June. In China, we have nearly completed the ongoing phase 1 dose escalation study as a single agent and in combination with toripalimab in patients with advanced or metastatic cancers who are refractory to or intolerant of variable therapies. We are now to expand the clinical study to further evaluate clinical activities in combination with toripalimab in selected solid tumors in a basket trial design by leveraging the data from the uliledlimab trial in the U.S. The first patient dosing of this combination trial was achieved in February 2021. The expansion study in patients with NSCLC and other selected tumors have been initiated in over 15 sites across China. The preliminary results are expected in 2022. Next, I would like to talk about our pre-NDA assets in China. First, felzartamab or TJ202. This is a compound originally developed by our partner MorphoSys. It is currently in development for multiple myeloma and autoimmune diseases such as systemic lupus erythematosus or SLE. Immediately after our in-licensing, we formulated a robust clinical development strategy targeting an NDA submission with the NMPA in 2021. The registrational trial for the treatment in combination with dexamethasone as the third line or beyond treatment in patients with relapsed and refractory multiple myeloma. The enrollment of this trial has completed. We are on track to submit the NDA in the second half of this year. The second line treatment in combination with lenalidomide for multiple myeloma is also on track and is currently enrolling patients. Full patient enrollment with a number of 291 is expected to complete in the third quarter of this year. Second compound for NDA is our enzalutamide alpha, or we call TJ101. The first patient in our phase 3 registrational trial in China was dosed in February. Originally, this compound was developed by Genexin, our Korean partner. We own the Greater China rights and believe this treatment has significant clinical advantages, such as less frequent dosing, better safety profile potential for long-term use in this young population. Pediatric growth hormone deficiencies represent a substantial unmet need in China. We are working closely with the Center for Drug Evaluation under AMPA with the goal to accelerate our trial and the registrations given the nature of the pediatric study. The primary clinical data are expected to be available in the second half of 2023 to support our planned NDA submission. Now, another compound, TJ107, is our first long-acting recombinant hormone growth human interleukin 7. The current clinical development plan is to evaluate the therapeutic role as a monotherapy for cancer patients with lymphopenia and as a combination therapy with PD-1 or PD-L1 antibodies for cancers. For cancer with lymphopenia, we initiated a phase 2 randomized single-blind placebo-controlled clinical trial in December 2020 in glioblastoma patients with lymphopenia. The primary outcome of this study is the percentage of patients with an increase in the absolute lymphocyte count and associated clinical response in relation to the treatment with TJ107. For a combination therapy with PD-1 or PD-L1 patients, We plan to submit an IND in China in the second half of 2021 to initiate a phase 2 clinical trial by basket trial design, in which PG-107 is combined with the PD-1 antibody for treatment of selected tumor types, including TNBC. The outcome of the study is expected to facilitate the development path of PG-107 towards a pivotal clinical trial. Finally, I will briefly discuss a few of our other clinical assets. First, for plonmarlimab, or PGM2, we are currently conducting a phase 2 clinical trial for the treatment of cytokine-releasing syndrome associated with severe and critically ill COVID-19 patients since last April in U.S. The clinical trial has progressed to the second part, aiming to evaluate the efficacy, safety, and the cytokine levels following a single dose of plonmarlimab at 6 milligrams per kilo, or placebo, which here means the best supporting care in patients with severe COVID-19. An interim analysis is planned in the second part of this year. In the same time, we have also initiated a phase 1b clinical study in patients with rheumatoid arthritis in China. In this multi-center, double-blind, placebo-controlled study, about 63 patients will be enrolled and receive a single dose or multiple doses of treatment for up to 8 weeks. The single dose escalation portion of the study is expected to be completed by the second half of 2021. Now another compound, olanzapine, or PG-301. For this compound, we have concluded our phase 2 clinical trial in ulcerative colitis in Greater China and South Korea, and we are now in the final stages of data analysis. To advance the development and maximize the potential value of this novel and differentiated molecule, we will continue to partner with Ferring, with plans to develop this compound in other inflammatory indications in which our CYP plays a role. Our newest monoclonal antibody to enter the clinical is TG210, directed against complement factor C5a receptor 1, abbreviated as C5AR1. A phase 1 clinical trial is ongoing with patients enrollment in U.S. to evaluate the safety, tolerability, and PK/PD profile in cancer patients. This program is expected to further evolve into a combination trial with a PD-1 antibody in selected cancer types. In addition, with the IND approval in China in February 2021, we also expect to initiate the phase 1b clinical trials in second half of 2021 in China. The results of the clinical studies in both U.S. and China will facilitate the further clinical development of this compound. With that update, I would like to introduce you to Mr. Yifei Zhu, our Chief Commercial Officer, who will discuss our commercialization progress. Yifei, please.
Yeah, thank you, Dr. Davidson. So it is my pleasure to join everyone today. And since coming on board with I-Mab in August of last year, so my sole focus has been on preparing the company for our exciting initial series of products in the launch stage. Today, I would like to walk you through our commercial strategy, initiatives, and progress to date. Our commercialization strategy is to designed to build a leading hematological oncology franchise in China through I-Mab's unique product portfolio, which includes the TJ202 and for multiple myeloma, and the TJ34 for various leukemia indications, and a later stage and asset to be in license to cover lymphoma indications. This combination of these three key products owned by I-Mab is unique and highly competitive in China, and enables a near complete coverage of major disease indications within the hematological therapeutic areas in China. More importantly, with this unique portfolio, we are well positioned to achieve a near-cure therapeutic goal through combination of our key products and with the other market products. In the meantime, we are taking concrete steps to build an effective commercial organization encompassing market access, medical marketing, supply chain, and the sales teams. The initial effort of the sales organization is to focus on the launch readiness of TJ202, our first hematologic oncology product. By targeting the top and the academic centers and hospital networks across China, where the target patient population accounting for a majority of the national cases is concentrated. With that update, I will now turn the call back over to Jiren, who will discuss our financial results.
Thank you, Yifei. Now let me turn to the review of our financial results for the year ended December 31st, 2020. As of December 31st, 2020, we had cash equivalents, restricted cash, and short-term investments totaling 4.8 billion RMB, or $734.1 million, compared with 1.2 billion RMB as of December 31st, 2019, representing a 3 times increase. The current cash on hand we have is sufficient to fund our operations through the year 2023, including data readouts on core clinical assets such as lemzoparlimab and uliledlimab, and also commercialization in China of our pre-NDA assets, felzartamab and efineptakin alfa. Now let me turn to the P&L side of things. Total net revenues for the full year 2020 were 1.543 billion RMB, or $236.4 million, compared with 30 million RMB for the full year of 2019, representing a more than 50 times increase year on year. The revenues generated for the full year of 2020 solely consisted of the revenue recognized in connection of the strategic partnership we signed with AbbVie last year. R&D expenses for the full year of 2020 were 984.7 million RMB, or $150.9 million, compared with 840.4 million RMB for the full year of 2019. This was primarily due to the increase in employee benefit expenses, which consist of share-based compensation and payroll expenses to support expansion of R&D programs. Administrative expenses for the full year of 2020 were 402.4 million RMB, or $61.7 million, compared with 654.6 million RMB for the full year of 2019. The slight decrease was primarily due to the reduced share-based compensation expenses of 305.7 million RMB, or $46.9 million. For the full year of 2020, I'm very pleased to report that for the first time in our corporate history, we had made a net profit. Our net income for the full year 2020 on a GAAP basis was 470.9 million RMB, or $72.2 million, compared with a loss of 1.452 billion RMB for the full year of 2019. Non-GAAP adjusted net income, which excludes share-based compensation expenses, was 997.1 million RMB, or $152.8 million for the full year of 2020, compared with a non-GAAP adjusted net loss of 936.7 million RMB for the full year of 2019. Net income per ADS for the full year of 2020 was 8.07 RMB, or $1.24 per ADS, compared with a net loss per ADS of 462.74 RMB for the full year of 2019. Non-GAAP adjusted net income per ADS for the full year of 2020 was 17.09 RMB, or $2.62 per ADS, compared with a non-GAAP adjusted net loss per ADS of 302.20 RMB for the full year of 2019. To support our rapid growth, we are actively monitoring market conditions and considering potential options for further equity listings on Greater China stock exchanges, such as the Star Market in Shanghai and the main board of the Hong Kong Stock Exchange under Chapter 18A of the Hong Kong listing rules. Now with that, we would now like to turn the call back over to the operator and begin to take your questions. Operator?
Okay, sir. Ladies and gentlemen, we will now begin the question and answer session. As a reminder, if you wish to ask a question, please press *1 on your telephone. If you wish to cancel your request, please press the pound or hash key. We have the first question coming from the line of Louise Chen from Cantor. Please go ahead.
Hi, congratulations on all the progress this quarter, and thanks for taking my questions here, and I meant this year. So first question I have for you is there's a lot of investor interest in your antibody programs, and curious how you plan to build a differentiated franchise here. And then second question I had for you was one of your competitors announced a positive GM-CSF readout for COVID treatment. I see that you still have this in your development and are looking at interim analysis. What do you think about this program right now? Do you think it's too late, or do you still think there's an opportunity for COVID treatments in the U.S. and globally? And then last question I had for you was that you have a very impressive list of data readouts in 2021 and beyond. What are, say, the 2 or 3 most important readouts in your mind for the company going forward? Thank you.
Thank you, Louise. Let me first ask June to talk about our TJM2 related to COVID-19.
Hi, thanks. Thank you for the question. Absolutely, we've been paying attention to these competitive landscapes, including to managing GM-CSF and IMAB. They have claimed the positive results for the similar treatment as we have done. So currently for us, we are still conducting a phase 2 clinical trial to evaluate the patients with the similar disease status. I have to admit it, we had delayed in the slowed down in the recruitment because of the vaccine availability and other treatment options. However, at this time, we have more than 100 patients available, which is adequate numbers for interim analysis as we originally planned. So we will have a planned interim analysis next month around, and so overall it's second quarter of this year. By then, we will look at the potential for advancing this program, including the potential for achieving UA or commercial partners if the results as promising as we have observed from humanity's compound. So on the other hand, we are also very positive considering the proven mechanism of action and also our compound features in comparing with other companies like GSK and Humanity. So altogether, we are very positive in terms of the continuing development path for this compound.
Louise, I can address your third question. We have a series of critical clinical milestones to deliver this year, as we just discussed. But I like to mention 4 of them because they're really critical in our minds. The first one is NDA submission for our CD38 monoclonal antibody that will occur in the second half of this year. and this is a really important milestone to achieve because this is going to signifies the company is moving into a commercial stage. And the second one I want to mention is a milestone for uliledlimab, our CD73 monoclonal antibody. In June, we will disclose, we will present all the detailed clinical data from our phase 1 clinical trial. And I must say, this phase 1 clinical trial has shown really good safety of uliledlimab and expected PK/PD. Above all, we have seen a favorable clinical activity of this antibody in solid tumor. And we will present detailed data, as I mentioned earlier, at the next ASCO meeting in June. And then the third milestone I'd like to mention is the for lemzoparlimab, our CD47 antibody. We are currently expanding a ongoing clinical trial in patients with solid tumor in the U.S. And by the end of this year, the fourth quarter of this year, we will be in a position to disclose the clinical data related to safety and the efficacy of lemzoparlimab in patients with solid tumor. And the fourth clinical milestone, which I think is also critical, is related to lemzoparlimab for non-Hodgkin's lymphoma. Now we're in the process of running a international clinical trial involving clinical sites both in U.S. and China in patients with non-Hodgkin's lymphoma. And this is a combination clinical trial of lemzoparlimab with rituximab for non-Hodgkin's lymphoma. And we expect to have data readouts by the fourth quarter of this year. Now, these two critical milestones are so important because, lemzoparlimab combination trial in non-Hodgkin's lymphoma may lead to a registrational trial in China. And this is going to help us to secure our position, our ambition to register our CD47 antibody as a first CD47 antibody in China. And this is our ambition to move forward very quickly with lemzoparlimab in multiple clinical trials in MDS, AML, and non-Hodgkin's lymphoma. So those are I would say, those are the four most critical clinical milestones among others. And then your first question, could you repeat?
Yes, investors have been quite interested in your antibody program, and I know you have quite a few compounds here and heading into the clinic. So just curious how you plan to differentiate your franchise from others that are in development. Thank you.
You're talking about our antibodies in clinical development, or?
Oh, yes, the bispecific antibodies. I'm sorry.
Okay. All right. So, so this year we have 3 new antibodies that have entered into clinical development in the U.S. The first one is TA210. This is a novel monoclonal antibody directed at the C5a receptor through a novel mechanism, anti-tumor mechanism. We're very excited about this novel antibody. And based on all the preclinical data, we're moving this molecule into a phase 1 clinical trial in the U.S. And the trial just started in the past 2 months or so. It's ongoing. And we also have a plan to initiate another clinical trial, a new trial in China. And the second antibody is our bispecific antibody. It's a highly differentiated bispecific antibody called TJ-L14B. This is a bispecific antibody with PD-L1 and 4-1BB. It works to maximize T-cell activation at the tumor site through PD-L1 and 4-1BB. As you know, both antibodies are co-stimulatory molecules to activate the T cells within the tumor. And the other advantage of this bispecific antibody is that the 4-1BB arm of the bispecific antibody is upon conditional activation, meaning the 4-1BB part of the bispecific antibody is not active in the system until it reaches the tumor site. So it works through a local activation of 4-1BB. Therefore, it will avoid systemic exposure and liver toxicity commonly seen with other 4-1BB antibodies used alone. So we think our bispecific antibody is highly differentiated because the 4-1BB part works through a conditional activation. Now the third antibody that also from that we also just received FDA approval to get into a phase 1 clinical trial in the U.S. Is a novel bispecific antibody called TJ-CD4B with Claudin 18.2 and conditional activation of 4-1BB. So it's designed to treat cancers expressing high levels of Claudin 18.2, such as gastric cancer, pancreatic cancer. This is a very novel molecule, and we, in the past few years, we have generated a very extensive preclinical data supporting its novelty and anti-tumor activity. Again, this molecule has a 4-1BB arm that only works at the local site to avoid systemic exposure and liver toxicity. And just last week, we received IND approval from the U.S. FDA. We are preparing to enter phase 1 clinical trial in the U.S. So those are the three new antibodies, monoclonal antibody and two bispecific antibodies that have entered the clinical development stage in the U.S. this year.
Thank you very much.
Thank you.
Thank you. We have our next question. This is please
Sorry,
go ahead, sir.
Go ahead. Sorry.
We have the next question. This is coming from the line of Joe Catanzaro from Piper Sandler. Please go ahead.
Great. Thanks, guys, for taking my questions. Congrats on all the nice progress here. Just two for me. I'm wondering if you can provide a little bit more detail on the tumor types that will be included in that lemzoparlimab China basket study and how that's informed by your early clinical data, translational data, competitor data, as well as the prevalence of tumor types within Greater China. And then my second question is, if you could just help set expectations for the upcoming R&D Day you guys are hosting in April, and whether we could see any new clinical data there, and if so, from what program. Thanks.
Thank you for the question. I can take the first question. Now we are taking 3 parallel approaches to identify or to select solid tumor types that may have the highest probability of success. The first approach is really to rely on our translational medicine study, looking at CD47 expression at the different tumor types. And you know, through the study, we have seen a range of CD47 expression in different tumors. For example, lung cancer, ovarian cancer, head and neck cancer have a very high expression of CD47, while other tumor types have a relatively low expression. So this is important to guide us as to what tumor types we want to select to start with for a better chance of success. And the second approach is really to based on our ongoing clinical trial in the U.S. in patients with solid tumor with a lemzoparlimab in combination with Keytruda. We are expanding the patient population and getting more data in terms of clinical efficacy signal, and based on increasing data that will also give us the opportunity to see what tumor types are more susceptible to lemzoparlimab in combination with Keytruda. And then the third approach is really to closely monitoring other companies, what other companies are doing, and their reports about their trials for clinical activity in CD47. Now, in a nutshell, for our expanded clinical trial, so in China, in the second half of this year, we will start a phase 2 clinical trial in patients with solid tumor with lemzoparlimab in combination with a PD-1 antibody. And to make a long story short, we selected lung cancer, ovarian cancer, and head and neck cancer for this clinical trial. And this trial is by a basket design, and the outcome of the trial may potentially lead to a registrational clinical trial in China. And we're looking forward to getting the trial started in China. Now, for your second question, the R&D Day, perhaps I will ask Jerome to comment. We are in the process of organizing the R&D Day and structure, the material we're gonna talk about. I'd like to ask Jerome to elaborate on our plan for our R&D Day.
Okay. Thank you for your interest in R&D Day. In terms of the arrangement, we have 2 sessions. One is China session, which will be more focusing on our hematologic indications landscape. And we will invite our KOLs, really top-tier KOLs, to give presentations on overall landscape and patient needs. Our management will present in much more in-depth of the progress of our clinical trials. Not necessarily the new data, top-line results, but we will just provide more details of our clinical programs and our strategies, as well as the timelines of releasing those data. In terms of the U.S. one, which will be in April 26th, it's the virtual in combination with our live sessions. Again, that one will be more focusing on the immuno-oncology landscapes globally, to really help us to facilitate the discussion in terms of our clinical programs as well as the overall landscape in U.S. And also, it will be composed of the KOL presentations from a prestigious academic institute, as well as our management team for detailed presentation of the plan, especially particularly the data readout of these years.
Okay, perfect. Thanks so much for taking my question.
All right, thank you.
Operator, can you take the next question?
Certainly, sir. The next question comes from the line of Kelly Shi from Jefferies. Please go ahead.
Hey, congrats on the great progress on all fronts. For uliledlimab, could you provide more details about the readout at ASCO regarding the patient number and also the split between monotherapy and atezo combo cohorts? That's first one. And my second one is regarding the CD47 antibody. I'm wondering that since you have chosen non-small cell lung cancer, ovarian cancer, and head and neck cancer for the China combo trial, should I think for the CD73 antibody, are you going to choose non-overlapping indications? This is not in your consideration. Thank you.
Thank you, Kelly. Let me take the first question. As we announced in February this year, we completed phase 1 clinical trial of uliledlimab in the U.S. The top-line results from our phase 1 clinical trial of uliledlimab with single-agent run-in and in combination with atezo have shown, first of all, safety profile and an expected PK/PD profile. More importantly, we're seeing favorable clinical activity of this molecule, uliledlimab, in patients with solid tumor. Now, for obvious reasons, we are under embargo by ASCO. So today we are not in a position to provide more detailed data, but for sure we will present all the clinical data, detailed data at the upcoming ASCO meeting in June. And by that time we'll be happy and we'll be very excited to share the data with you and with others. Now, for your next question, what is the next question?
Kelly, can you repeat the second question?
Absolutely. So for the lemzoparlimab, you have chosen non-small cell lung cancer, ovarian cancer, and head and neck for your China combo trial. Therefore, when you consider the next step for the CD73 antibody, are you trying to choose a non-overlapping indications, or this is not your consideration? It's more like efficacy driven at this moment. Thank you.
Yeah. Thank you for the question. It's a great question. As I mentioned earlier, for lemzoparlimab, we have selected lung cancer, ovarian cancer, and head and neck cancer in a basket trial. This is our plan to move forward for lemzoparlimab. For uliledlimab, there are also some overlap with the cancer types because for uliledlimab, lung cancer, non-small cell lung cancer is also among the cancer types we selected to move forward. So there is some overlap in terms of the indication between the two monoclonal antibodies, but largely there are different indications for different antibodies.
Thank you very much.
Thank you.
Thank you, Kenny. Operator, I think we need to wrap up here, but we can take one more question.
Certainly, sir. The last question for today's evening is coming from the line of Changping Guang from Yuatai Securities. Please go ahead.
Hi. First, congratulations on the remarkable milestones achieved, both clinically and operationally in year 2020. I have got 3 questions here. The first involves our CD38 antibody. So could you introduce the potential pricing strategy of I-Mab after its approval, especially just knowing that Mr. Zhu Yifei is mentioned that he's trying to constructing a marketing team for this drug. Also, we have noticed that the pricing pressure in the national reimbursement drug list negotiations. So do we plan to experience a very significant price cut for the inclusion of TG202 in NRDL? The second question is about our financial performance. I noticed that the company has recorded revenue of $236 million and a positive net income, which is not normally seen for a biotech. I suppose that the revenue is boosted by the collaboration with Abway, correct? So could you further elaborate this impressive financial performance? And the third question involves our recent collaborations. So could you give a very brief introduction of the masked antibody? It seems that it is very hard to identify some background information. Yeah, that's all my questions.
All right. Thank you for the questions. Maybe I first ask Jielun to address the second question, and then why others are preparing to address your other questions. All right, Jielun.
Thank you. Yeah, Chongping. So let me address the first and second questions, and I'll leave the third one to one of our management. So the first question you asked is about the pricing strategy for our CD38 monoclonal antibody. I would like to first start by saying that the CD38 market in China is quite stable in terms of competitive intensity. Right now, there's only one molecule or one drug that's approved by the Chinese FDA, which is daratumumab, and it's roughly a year ahead of us. So we think the types of pricing competition you see in other areas or therapeutic areas, for example, the PD-1 or PD-L1 market in China, I don't think you will see that with CD38 in China because there aren't that many competition. And going forward, I think it will be daratumumab and us for the next few years. So I would like to start by saying that. The second thing is in terms of pricing strategy. We are, as a local player in this market, we think we have some inherent advantages in terms of pricing flexibility. The first one is that, our CD38 is only going to be marketed in China. So we don't have a global pricing system to protect. So China is our only market and is our home market. So we will do everything to make sure that we have the maximum market share in China. The second thing I would like to mention is that because we were going to be manufactured this product in China in our own Hangzhou facility, so we will enjoy a better COGS position than our foreign competitor. Therefore, allowing us to negotiate better with the NRDL when it comes to that types of negotiation. So our strategy will be to get on the NRDL as quickly as possible, but also make sure that both in terms of cost position and also the pricing flexibility, we can get on, we can be as flexible as possible when we negotiate with the NRDL. So that's my answer to your first question. The second question you asked is about our financial performance, and thank you very much for congratulating us. I think the biggest driver for our performance financially last year is the faster and a better progress in our partnership with AbbVie. So we had received not only the upfront payment but also the first milestone payment, and we are on our way to work with AbbVie to realize the second milestone payment. So I think that business reality was reflected in our revenue recognition. and therefore you're seeing a perhaps better than expected net revenue and also net profit performance from our financials. Third question, I would.
Yeah. So I also like to add, it is unusual for companies like us to be profitable at this stage. I think what is important is that, over the past few years, especially last year, with the partnership with AbbVie, we have been building a significant revenue stream from our licensing. And as I mentioned earlier, this licensing revenue stream will converge with sales revenue when we have the first product launched in China. So we're quite excited about this perspective, how we're going to build our revenue stream over the next few years. Now, let me address your third question. Now, recently, as you have seen, we signed 2 deals with 2 separate companies. And this is part of our new discovery initiative to work with companies with transformative platform technologies. Okay, so one company is Complex, as I mentioned earlier. It's a European company with unique platform technology to generate antibodies, specific formats of antibodies, in able to get into cells. So those are cell-penetrating antibodies. And we're very excited about this opportunity because, through such platform technology, we'll be able to generate a panel of novel antibodies that can penetrate into the cell and to target intracellular targets that are otherwise intractable. And that really opens a lot of opportunities for us. And the second partnership we signed is with a Shanghai-based company called Affinity. They have this unique technology to mask antibodies, and only the antibody, in the system, the masked antibody will not work because they're not active until the antibody reaches the tumor site where the masking peptides can be cleavaged by the enzyme, specific enzymes only exists inside the tumor. So this technology enables us to generate novel monoclonal antibodies that can only activate at the tumor site for a better efficacy and also to avoid systemic toxicity for some selected targets. So we're quite excited. We have agreements in place to generate a series of masked antibodies for different immuno-oncology targets.
Okay, thank you, Dr. Zhang. Sorry, according to a description, it seems that the masked antibodies are something kind of a ADC, right?
No, this is not really an ADC. So it's a technology where you can attach a masking peptides to the active sites of antibody. Okay, so that antibody will not be active in the circulation in the system. But when the antibody reaches the tumor site, the masking peptides will be cleavaged, will be destroyed, so to speak, by a specific enzyme only existed in the tumor. So the antibody then becomes active in the tumor site. So that technology, as I mentioned earlier, enables us to make novel antibodies to avoid potential systemic exposure or toxicity, and for the antibody to reach to the tumor site to be active and to exert anti-tumor activity only at the tumor site.
Okay, thank you. Very helpful.
Thank you.
Operator, we have to wrap up the call.
Certainly, sir. Ladies and gentlemen, that does conclude our conference call for today. Thank you all for your participation. You may disconnect.
All right. Thank you, everyone. Thanks for your time.
Thank you.
Thank you.
Talk to you soon. Bye-bye.